Now let's talk for a moment about splint design options, because there are basically three that we work with. The first is a splint which only touches the front teeth. Let me show you an example. We often in dentistry will call these Lucia jigs. Some people will call these anterior deprogrammers. We call these B splints or bruxing splints. So there's a place for these in our armamentarium. Secondly, there's a splint which idealizes the whole occlusion to the seated joint position, centric relation. We're going to call this appliance a superior repositioning splint. And thirdly, we have an appliance which can move the jaw forward to avoid loading on painful retrodiscal joint tissues. We're going to call this an anterior repositioning splint, or an ARS. Let me describe the B splint to you a little bit more. The B splint is ideal for occlusal muscle. It's ideal for parafunction, such as bruxing type problems. It's questionable when you have unstable discs. And so here's the design as we look at it. Only touches in the front. It will only touch on the anterior teeth no matter what direction we move the mandible. Back teeth are always separated. And one of the interesting things that we found through EMG studies is that when posterior teeth are separated and you only touch in the very front, you can reduce elevator muscle activity even on clenching by as much as 80%. SRS, or superior repositioning splints, are ideal for relatively pain-free joints which have potentially unstable discs, such as in the Piper stage 3 and 4, where there's internal disc derangements. The only thing I would mention here that we have to be aware of is that patients, when they touch all the way along the back teeth as well, can still clench effectively if they're determined to do so. And then finally, the ARS, anterior repositioning splint, this will effectively forward posture the mandible when we're trying to avoid loading painful retrodiscal joint tissues. More of the Piper stage 4 surgery candidates, those that are off the disc and loading up on painful inflamed retrodiscal tissue.